Hello, everyone. Welcome to another episode of Coach Krisler's Convos. I'm here with a new friend and fellow FMCA grad, Mahboub. Thank you so much for being with me today.
Krisler, all the pleasure. Thank you so much for having me here today.
Well, before we talk about your health journey, I would love for you to share with those that aren't familiar with you who you are, where you're from, and what you do.
Right. So great three questions, and I would try to, you know, reflect them as precisely as possible. And I would start from the present, right? And then we can go back to the little past and then the future. So this is how I would feel it would be a good thing to do. Um, so currently, presently, as you said, I am working as a certified and registered health coach, health and wellness coach. I'm based out of Toronto, Canada. And people who don't know much about Toronto, so Toronto is a part of Ontario, which is the largest province of Canada. And within Ontario, there is a place we call GTA, or Greater Toronto Area, which comprises of 5 or 6 cities, which are very much, linked and connected together. So I am in GTA in Toronto area and in Ontario province.
That kind of sounds like where I am. We call it the DFW Metroplex. So
Right.
Dallas and Fort Worth are the major cities, and there's a bunch of cities kind of in between that make up the Metroplex.
Got it. Yeah, pretty much the same. Yes. And I've been, doing this health coaching thing formally now, with MCA and then FMCA. But the thing is, there is a long story, or there is a reason behind all this journey that why I'm here today and why are we connected and, talking on this subject. So that's about my present. About the past, quickly and as we say, fast forward mode. I was born and brought up in a country called Saudi Arabia. So I hope most of the people, they are familiar with this country, Saudi Arabia. It's in the Middle East. And as a matter of fact, it's one of the largest countries in Middle East, which is a kind of peninsula. And peninsula means like it's covered, or it has 3 borders of water. Water means like Red Sea on the west coast, Indian Ocean on the south, and then the Gulf Sea on the right coast or on the east coast. And then on the north, it's, connected with the land with rest of the Middle East and, like North Africa, or, in the map it's more. So I was born and brought up there, to, parents who were also immigrants in Saudi Arabia back in 1960s. Yeah. So I was like born, and then I studied like my elementary, school, middle school, and then until the high school, I was there. After that, now again, it would be a surprise for most of the people who don't know about the country. In Saudi Arabia at that time, it was not possible to continue the higher education or any sort of professional education for expats. Because although I was born there, we were there as an expat. Expat means we were not the citizens of that particular country, even after we were born there, right? It's their policy, which we agree. So then I went to my parents' home country, which is Pakistan. And so I spent 6 years of my life there. Another city in Pakistan, which is called Islamabad, which is a capital as well of Pakistan. And then I did my medical education, or in your terms, it was the MD or my undergrad in medicine from Pakistan. And that was the 6 years when I stayed there. So after 18 years in Saudi Arabia, I went straight to Islamabad to continue my higher education, or let's say my medical education.
Mm-hmm.
And after finishing from there back in 1996, I moved to UK. And then my interest at that point of time was to pursue my fellowship or my specialization in radiology or in healthcare imaging.
Mm-hmm.
So I stayed in UK for around 4 years, from 1997 to until the beginning of 2001. And then I completed my, fellowship or my training in clinical
Mm-hmm.
radiology. And then I started working as a specialist in radiology back there. And then due to my family, who were already, they were still based in Saudi Arabia, I moved back in 2001.
Mm-hmm.
And then since, my parents, they were there, and then I was like a young practicing doctor. So, as whatever happens in the families, especially, in our families, in that culture, my family, they wanted me to get married,
Mm-hmm.
right? Because I was seven of my siblings. Rest of them, they were settled in their life, and I was the only one who was not married at that time.
Yeah.
So, naturally, parents, they said, you are the only one, so please go ahead and get your, with your life, and we want you to get settled. So then I got married in 2002. Yeah, and then in between, like I was working as a radiologist, you know, in one of the hospitals there. But
Mm-hmm.
then I, it was one of the pivotal things which I wanted to share with you now, because it's so important. It's one of the benchmarks, or I would say milestones in my life, because people still today, they ask me that why did I leave, or why I left the typical clinical job or working as a medical doctor
Mm-hmm.
in 2001, right? So there was a little incident which happened, and I would like to share that. And
Yes.
then I would discuss about my next 20 years, which was from 2001 until 2021,
Mm-hmm.
right? So I was working in one of the big private hospitals in Saudi Arabia.
Mm-hmm.
And, it was like a young, energetic radiologist, who was working behind the scenes always. Behind the scenes means, Krisler, that I was not used to talk to patients, because in
Mm-hmm.
radiology, we normally just write down so what we do, we read the radiographs, we read X-ray, CTs, MR,
Mm-hmm.
ultrasound, and then we write down the reports, right?
Right.
And then we hand it over to whoever is asked for it, and then that's it, that's our job. So it was very rare to interact directly with the patients.
Mm-hmm.
And that was the first time in 2001 when I realized that that's not me.
Yeah, I can see that. I mean,
Yep.
just from meeting you,
R-
we've only known each other a few weeks.
right, right.
Just from meeting you and talking with you a few times, I can tell you love to interact with people.
Exactly,
So
exactly.
yeah.
And but again, thanks for discovering, that strength or characteristic, whatever you call it.
Mm-hmm.
But again, the point is that I realized that I'm a people's person, number one. And number two, I have to interact, with one to one,
Mm-hmm.
either group one to one. So, having said that, what happened, the incident, that it was, I still remember today vividly, it was 5 a.m. in the morning, 5 a.m. And being a junior doctor, I used to work off times.
Mm-hmm.
Like the senior doctors, they used to work from 9 to 5, and juniors like me, they used to work in the like off peak times, or
Yeah.
on call sort of stuff.
Right.
So I was sitting on the reception, again, being an alone radiologist there. So I used to come back on the front desk, and
Mm-hmm.
we used to chat with the staff, with the scheduling person, with the
Yeah.
team. So a young man, he walked in and he had a slip in his hand which said that he needs to go through an abdominal CT scan or abdominal CAT scan. And it was, like he was a young guy. And then when I took the slip, I looked at, into him, and then I realized that he, with the body language, that he is not happy at all or he's not well. So because of the time, I said, okay, I asked the nurse to register him, and I said, I just started talking to him that what's the problem. And at that time, we as a physicians, we used to ask patients, what's wrong with you, right? But now, after 23 years, my approach has changed. And again, thanks to FMCA, thanks to functional medicine, that instead of asking them now, what's wrong with you? Now we ask them, what's strong with you? You see? So
Yeah.
like it's just the approach. It's just the mindset. So at that time, I asked him, what's wrong with you? Why you are here? And then he said he had been suffering from chronic constipation. And he was, visiting one of the big consultants there, and they suggested him to do a CT scan for him. Now, since I was trained in UK, and when we were trained, the first principle of this training was to observe ALARA. ALARA stands for as low as reasonably achievable radiation. Right? So we don't do undue radiation exposures, especially, to the patients who are less than, so I would say in easier terms, from 18 until 55, it's a general rule that we don't want the population to get exposed to radiation unnecessarily. Because these are the productive ages, and
Right.
only one X-ray or only one episode of radiation can trigger, like oncogenes or so many things which we don't know.
Right.
So that was my theme to, why all of a sudden a CT scan, why not something non-invasive?
Right.
Right? So and to me, that was an ultrasound thing, because ultrasound is a very safe exam. So I told him, I said, you know what? I would do an ultrasound for you before we do a CT. And with his body language, I could see, because that was a private hospital. Insurance was a big issue, so I could sense that that particular patient, he was a bit anxious of going back through again that process of approvals, and long story. So I assured him, I said, I would do it for free for you. I just wanted for my own satisfaction, I want to see what's going on with you. And he agreed, because if something is free, he agreed. So long story short, again, I did a quick ultrasound for him, and what I found, that his abdomen or tummy was full of gases and full of like fecal matter. So he was chronically constipated, right? That was his only problem at that point, and he was a young patient. So again, I suggested him, after listening to him, that why do you have this constipation? For how long this constipation is with you? And I spent almost half an hour with him, just listening to him, right? And then I discovered about his diet. I discovered about his eating habit. And he was like a person who was alone, like in a labor role. So he had no idea about healthy diet, healthy foods, right? And naturally he developed this constipation. So I told him, or suggested him, that I could write down something for you. It's like a quick fix to release his constipation, and then give him some modification for the diet, enough water, enough fiber, in different terms. And then I told him, if you are okay within a week's time, then in any case, you come back to me and we're going to do the CT scan.
Mm-hmm.
Okay, so just give yourself a week and then come
Mm-hmm.
back to me. I would do the CT scan, no problem.
Yeah.
And then
You were coaching him.
I was coaching him, but
You
without
were
knowing.
already in that mode of thinking
Exactly.
of multiple things that he
But
could do.
exactly. Krisler, I didn't know that I was coaching until very recently. You know,
Yeah.
that's the whole point. That's the whole point why I'm sitting here.
Amazing.
Yeah. So now again, it happened, life or moving on. I forget about that person, right?
Mm-hmm.
Now, after 3 days, exactly after 3 days, I was busy in one of the procedures. We call it fluoroscopy. So I was doing a fluoroscopy for a
Mm-hmm.
patient inside. You know, when again that nurse, she came to me and she said, somebody is waiting for you for more than an hour and he wants to see you.
Mm.
And I had no idea that that could be that person, but I said, okay. So I used to wear my gown, you know, radiation and everything. So um, after getting over with that patient, who were inside in the procedure, I came out, and to my surprise, that was the same person. And now he had a small packet of chocolate in his hand, you know, happy face. And then he said, like, you know, in his own language. So another good thing is, um, Chrysler, that I speak fortunately 5 languages.
Oh, wow.
Yeah, you know, so that's another story. But so I could relate to him in his own language
Yes.
because he was not able to speak English fluently. He was not
Mm-hmm.
able to speak Arabic fluently, which were the two main languages there. But I could communicate in his own language,
Mm-hmm.
right? So that's why he just told, and he told me in his own language, uh, and I can repeat it here. He told me, Dr. Saab. So Saab means, you know, like sir, or it's out of respect. So
Mm-hmm.
he told me, Dr. Saab, I'm totally fine. You know, I've been going to washroom. I'm eating as you said to me, and there's no pain, no bloating, whatever, blah blah blah. And I just came to, you know, say you thank you,
Mm-hmm.
and here is a little gesture or gift from me if you could accept it. Okay. I said, well, I'm so happy. Thank you. And then, so do you want to do a CT scan now? You know,
Mm-hmm.
he said, do you think it's necessary for me now? I said, let me check you again. Let's come quickly. So I again scanned him, less than
Mm-hmm.
5 minutes. And I said, you are as good as anybody else. I don't
Mm-hmm.
see anything, any problem. So to me, you are good to go. Okay. So now what happens, and that was the pivotal point. This patient, out of excitement, he went to that doctor, to that consultant who prescribed or who suggested him a CT scan.
Mm-hmm.
And he told him that, and he was a big consultant, by the way, right? So imagine this, I was the most junior doctor, and that was a professor of medicine who
Mm-hmm.
prescribed him to do a CT scan. So when he met him, and he said that I'm okay, I don't need
Mm-hmm.
anything, and you know, just that's it. He went to him out of respect again, you know,
Right.
out of just to close the loop. But then what happened to me? That was the life-changing situation. That I got a call from my head of the department, and he said, you know, we need to talk. So please come to me and have a cup of tea or coffee with me. Now, I could sense that this call is not something, you know, on a positive note.
Right.
I see him every day in the morning meetings. I see him, you know. So the way he asked me to come and have a cup of coffee, something is fishy,
Right.
right? Yeah. And then exactly that was my gut feeling at that time. I met him, and the bottom line was that I am not supposed to interfere with other consultants or with other doctors, you know, when they prescribe anything for their patients. My
Yeah.
job is just to follow the orders, and that's it,
Mm-hmm. Mm-hmm.
right? Okay, fair enough. I tried to explain him that this is for the patient, and this is, you know, for the benefit. We are all here to serve the patient, blah, 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 you know, all my teachings of radiology and how to protect. He said, I understand this, but we are, and I'm quoting unquote, right? I'm quoting the exact the same word. He said, Dr. Siddiqui, we are not running a charity hospital here. It's a private hospital, and we have to, follow the SOPs, our standard operating procedure, and
Yeah.
we should not interfere in other people's businesses. So that's the thing. I was a bit, down at that point, and then I came home. Again, I met my father, I met my mom. We had our dinner together, and they sensed me that I was feeling low at that time.
Mhm.
And then my dad, he asked me, that what happened? You don't feel joyful or this and that. And I told him, I said, this is what happened with me, and I'm not feeling good. So um, again, those were the golden words of my dad. He passed away back in 2005. He told me, he said, Mahboub, uh, you have earned this degree or this profession with integrity, to serve humanity. So if I were you, so now he's telling me, my dad, if I were you, I would not continue with them, and I would simply resign.
Mm. Wow, that's
That is,
huge.
yeah, that was huge. So this is what he told me. He said, these are not the right people for you, and you don't have to earn your livelihood, with, without integrity. That was
Mhm.
his simple word, right?
Mhm.
And that was totally, it came to my heart, and I said, okay. Next
Mhm.
morning, I was there with my written resignation, and I gave it to my head of the department. That's it. And now I'm sitting at home. Now, look, and he said one thing more, my dad. He told me that, if you are sincere in your efforts, then God, or, Allah, whatever, we believe, He would open another 10 doors for you
Mhm.
if one door is closed for you. So you don't have to worry. That's
Mhm.
what exactly he told me. So I was at home, I had no pressures, no nothing, no family, like my own family, I mean, so I
Right.
was just chilling. And then after a week's time, I received a call from the same head of the department. And he told me, he said, because, I had always good terms with them. Whenever I leave a place, Krisler, I don't shut down, like, we don't shut the doors,
Yep.
but it's always open, right?
Right.
So,
You
yeah.
don't want to
So,
burn any bridges
no, no, no,
because
no,
you
we
never
don't. So,
know.
he
Yeah.
said, Dr. Siddiqui, I'm just calling you. And by the way, those were the times when we had no cell phones, right? I
Yeah.
didn't have any cell phone. So even at that time, I'm talking about 2001. So I had no personal cell phone at that time. Yeah. So he called me on my home phone and he told me, there, I know you are a very academic and you are always eager to learn. So
Mhm.
there is a symposium, and that symposium was about virtual colonoscopy, or, the trends in colonoscopy. It was
Mhm.
one of, emerging um, technologies at that time. And he said, I have an invitation. It's a big company, and the company's name was General Electric.
Oh wow. Yes.
Okay, maybe you can connect the dots a little bit now,
Yes.
right? But
Yes.
he said there is a company and they have given me this invitation, so feel free to go and attend this because I am so busy.
Mhm. Mhm.
Okay, so I was free, went to that event. It was a great, learning event for me. And out of, again, my curiosity, I asked, couple of questions. I was engaging, with the presenters whatsoever. And then during the lunch, or no, yeah, it was dinner time. During the dinner time, the the not CEO, the general manager of that company, which was General Electric,
Mhm.
he came to me, he joined me, and he said, can I join you? I said, yeah, for sure, please. And then we started talking. And then he said, you know what? Um, we are General Electric healthcare company, and we manufacture all those equipments like
Mhm.
CT, MR, and whatever. And I'm looking for someone who can do like teaching for for, for our equipment. At that time, I had no clue what he was talking about. And he said, you can, if you are interested, he gave me my card and he said, if you are interested, please reach out to me. And okay. So came back home. And then when I was, so again, there was no Google. There was, not too much these search engine type of things.
Right.
So I started, discussing it with my, like, I do have like my elder brothers and, who were already in the field. And like, and I was trying to explore. And to somehow, I ended up in meeting that person. And he told me that they want to hire me as the clinical education specialist for the purpose of training. And there was a slogan like training for radiologist by the radiologist, right? So
yeah,
that
so
was a
cool.
new concept on a commercial level. So because before that, nobody was, it was maybe like engineers, the biomedical engineers, but to get somebody from the clinical background, it was the first example for them. Or like, and I agreed. Why? Because I needed a job.
Right.
Right.
Yeah.
Now coming back to you, and again, it's surprising, without going to the numbers, the offer which I got, okay, it was 3 times better than what I was getting as a young doctor at that time into that hospital.
So cool.
Right. So there were so many things so the offer was too good to say no.
Yeah.
Right.
Yeah.
And
Yeah.
then out of, again, I am interacting with the people, I'm going for training. So that was something which excited me just by thinking about. Right. So then it was, now I still remember March 2001.
Yeah.
And you would be surprised, I still remember the date. It was March 10th, 2001, when I joined them as the clinical education specialist.
Yeah. And you
And
got out of the back room.
exactly,
In
in the front. Thanks.
It was amazing.
Yeah. So now that's the step number 1. And then the journey started. Whatever I'm today, Krisler, whatever I'm today, that I worked for this company or that GE Healthcare for more than 21 years. And,
Wow.
that was the time when I explored, whatever my potentials were, thanks to, my great managers at that time. But then that was the time when I had an opportunity to travel around the world. Okay. And maybe if I've shared it with you, but I had an opportunity to travel more than 90 countries. Right? 90 countries around the globe. Okay. And so that was a kind of dream job for anyone. On company's expenses, you are going out there, any continent, you just name the continent. And I was there. How? Again, for training purposes, for my own trainings, for exhibitions, for trade shows, and so on. So when I started with them, it was only for that country, Saudi Arabia. And then, there was an opportunity to climb all those corporate ladders at that time. And then my geographical responsibilities, they were growing. So from one country, I expanded to the region, which was the Gulf, 6 countries, from there to the Middle East, from the Middle East to Middle East and Europe, and from there, the global role. And when I say the global role, which means all 6 or 7 continents, right? From Australia to New Zealand to Japan to Southeast Asia, right? To Middle East, then to Africa, North America, South America, and the whole Europe. So that journey, or that 21 plus years, they exposed me, or they gave me this opportunity to do whatever I am today, in terms of a person, in terms of the networking, and in terms of learning about cultures, learning about different people, bringing out of your own silos, like then you don't think about yourself, you don't think with your lenses, then you
Yeah.
always think about the other person's perspective.
Right. Right.
So,
And I bet that that has helped you in your coaching
in
to
my
be able
coaching,
to step outside of self and step into the shoes of your client and
exactly,
help them figure out what
help
they need.
which they need, right?
Yeah.
So in that way, I was very much fortunate enough, Krisler, that my students, or like the people I used to give training, they were
Mm-hmm.
from across the globe.
Mm-hmm.
Okay, so I can say it proudly, like from every region, from every almost country, continent, and they were all highest qualified in their own fields. Like they were doctors, they were sonographers, they were radiographers, most of them. Now we would put this aside now, and I would shift the gears that the clinician, or that doctor who had empathy inside me, that was
Mm-hmm.
still there,
Mm-hmm.
right? That was still there. And then what happened when I used to finish my routine work, and then when people, or all those guys out there, or even my colleagues, when they always knew that I was, by training, I was a clinician, right?
Mm-hmm.
So during lunchtime, during happy hours, when we were just chilling around after congresses, how things work, they used to discuss their issues with me.
Mm-hmm.
And I used to advise them with, again, best of the best of my, knowledge or whatever. And again, what was the best part? Only two words, Krisler: listening
Mm-hmm.
and empathy,
Mm-hmm.
right? I was
Yeah.
not in a position to diagnose anything, although I did. I was not in a position to write down treatment for them or a prescription for them, but
Mm-hmm.
they always felt, secure, and they always felt value
Mm-hmm.
in discussing their problems with me.
Yes.
Okay, so again, there is nothing inside me. I'm not giving this credit to me, but that was something internal. So what we did, what we did, because I was based in Saudi Arabia, so with some like-minded people, with some like-minded, physicians, working physicians, we started a concept of, free medical camp.
Mm.
Okay, and that was started in 2005. Okay, and this is very important to know here because it is linked to my journey for FMCA. Now, we started, what do we call, Patients Welfare Society, which
Mm-hmm.
which which and in that part of the world there are so many people who were out of medical insurance, and they needed free medical consultations and free medications. So what we did, again with the network, we started doing bi-monthly or bi-weekly medical clinic
Mm-hmm.
with different specialities,
Mm-hmm.
right? And then, like, one doctor for medicine, one doctor for kidneys, one doctor for women healthcare, like OBGYN, one pediatrician. So we had a group of 10 doctors. And what was my job? Thanks to again my company, or GE, I had a small laptop size ultrasound or portable ultrasound machine, and
Mm-hmm.
I used to do free ultrasound for them.
Mm-hmm.
And then again, because I was there and I had not much patients, so when the patients, they were sitting or waiting to get their prescription, I used to talk to them
Mm-hmm.
again. And when I started talking to them, educating them, awareness, like a person, he is using uh, medicine for diabetes for 10 years, and his hemoglobin A1C, or, diabetes is not controlled. He is
Mm-hmm.
using hypertensive medications for more than 12 years, and he's not, you know, treated. Now, what's
Yeah.
the problem? What's the root cause? Right? So again, I started exploring and telling
Mm-hmm.
them about the diet, lifestyle modification, all sort of things without knowing that this is the coaching.
Yeah.
Yeah. So what happened now in those years? So I'm talking now about from 2005 until 2018, because even at that time, as we are talking today, that free medical clinic services is going on there, because that was something like something good. It still is going on. If I'm not there, there are other good people who are running this show. So, and again, so they asked me, or the team, they asked me that instead of doing those ultrasounds again, I have to sit on a table and a chair, and then we should educate those people about the lifestyle modification. Right? So, and then in the meantime, also something happened, that my dad and my mom, they were diagnosed with some other chronic illnesses, which the typical or conventional medicine had no cure, or it was typical medications, polypharmacy, that they used to give 5 or 10 medications and that's it, right? So that was the time when we discovered about detoxification. We discovered about the organic foods. We discovered about again intermittent fasting, or the regular fasting, all those things which empower you, or which as Dr. Mark Hyman said, that your lifespan, if is it equal to your health span, that's the ideal scenario, and so what I'm happy about, that no matter, nobody's indispensable, everybody has to go, but as much as they lived a better life, right? So that, like, they enjoyed with fulfillment, they enjoyed their life, and then there are things which we cannot undo simply. So but so that's another eye-opening experience. And then come back to me now, the final thing. Now, because of extensive traveling, because of extensive jet lags, so many things, what happened with me, that I was totally, like, as we call it now, I was in the poorest of the poorest dietary habits. Like, you are traveling and then hoteling and all those things. There was no fixed time for eating or sleeping or resting, nothing. And then I developed.
Isn't that interesting that you are working with people on lifestyle modification? You're listening to them, and helping them.
Exactly.
And yet you personally are struggling because of what was going on in your life, just with the traveling and this working and all of that.
All of that, right? Now, there is a triggering point, right? There is, as we learn, in functional medicine principles, there is a timeline, and then there is something we call a trigger. So for me, the trigger was, I started feeling pains in my knee joints. Okay. Now, why this knee joint? Okay, best of the best orthopedic, specialist, right? Around the world, my friends, my seniors, who whatsoever, and then they told me, they said, well, there are a couple of reasons, but the main reason is you have to reduce some of your weight. Okay, yeah, I do understand, but again, how to do that, right? I have no time. Right? The typical question. I was not in the pre-contemplation stage. I was in contemplation. I was not even in the, I was not ambivalent. I knew what my problem was, but the issue was, I have no time for myself.
Right.
Yeah. So, so then, I met again, great friends and, great stories, but I met one of my childhood friends, who is still my friend now. And, so he did one diet for himself. And, that diet was, it was, I think, from Sacred Heart Institute or something like that, which was, like to just kick off or kick a start with some intermittent fasting, and which was manageable for me with my hectic schedule. So again, long story short, I started working on that diet, and then it was 2011 exactly when I lost uh, within 2 years I lost around 20 kgs, 20 kilogram. I think it would it I'm not very familiar with the pounds or the lives, but 20 kgs was a big thing at that time. And then same thing, the whole knee pain was gone. The I was doing exercise, no matter where I am, no matter which continent. You would be surprised to know that I used to exercise during my flights, during my long haul flights.
Yeah, that's great.
So look at that dedication, look at that commitment to yourself. That, and then I started not eating everything, like in we have an options in plain or in the food menu, that to choose your meal, right? So I went for the healthiest meals, all those options. And so back to the point, that was the personal story, that how lifestyle modifications, they changed my own life. And I realized that whatever happens, you have to love yourself, and your health should come always first to you, right? And then as we said, the approach, not talk the talk, but walk the talk thing, right? So, and when I was doing this, people, they changed the feel in me. So whatever messaging I was delivering now, it was 10 times more powerful. It was 10 times more, impactful than ever before, because they have seen me doing this, and then they knew that if that person can do this, we can also do that. Right. Yeah.
Very
So
powerful to not just tell people, but to demonstrate it as well.
Demonstrate, like as I said, like walk the talk. So preach, or do what you preach.
Right.
I mean, there are so different things. So that that journey to continue helping anybody out there with their health challenges. So that was like a constant thing for me, right? And then I came to Canada in 2009. So there are other life events as well. So I got married, everybody, like everybody else, I got my kids, like so my eldest one, he was born in 2003. My daughter was born in 2005, right? And then my youngest one, he was born in 2017.
Oh wow, that's a big jump.
Yeah, so we have three now, like and so this youngest guy.
With all of your experiences and your travels, and finding out about lifestyle changes and changing your health and marriage and all the kids, how did you come to find FMCA?
Okay, now since we are coming directly now to FMCA, let's do that. 2021, I was still working, with my previous company, and we were handling the post-COVID scenario. Okay, when we were told that all those the company was going through restructuring, the company was going through whatever, so they started laying off some of the top management, and the roles which they thought wouldn't be necessary at that time, right? So then that was 2021 when I came to know that we have to step down with the existing role, then we need to do whatever we can do. So I started working as a consultant in my existing, or my previous role, which was about digital health. It was about medical equipment, product management, product development, the enterprise imaging solution, the artificial intelligence solutions for healthcare, all sort of things, virtual health. So I was working as an independent consultant, being based here, as a like as a part B, or as a plan B, because I had to do something. Now, during that time, I came across with one of my friends who is working now. She's based out of Florida, and she is a working MD in internal medicine. And while just regular chit chat, she told me that she had gone through the IFMCA program, which is for the physicians, right? And she found it very effective and powerful in a way, how to help her patients in a much better way. And the idea was I have to look into it as well, because now I have some time, and if I'm interested, I can go ahead with that. So if you know, IFM or FMCA or IFM, they have two streams. The one stream is for the practicing physicians, which we call IFMCP. And the other stream is FMCHC, which is Functional Medicine Health Coaching Academy. Right? So the one track is for the coaches, and the other track is for practicing physicians. Right? Now, since I was not a practicing physician for a long time, because I quit clinical radiology,
right,
technically, 20 years ago. So I was not a practicing physician per se, or as per the requirements, as per the prerequisites. But for me, this path or this track, which was for the functional medicine coaching, I was a great fit to start that track, right? And that was the time, July 2022, when I reached out to FMCA team, and my first interaction was with Dr. Sandy. Okay, and again, I would always be grateful for her wisdom, for her vision, that to somehow, and one of my characteristics is the prudence. So I was so much careful in selecting that, because it was 1 year commitment.
Right.
With the studies, with everything, and not that, with my hard-earned money, right? To invest. So it was time, it was money, it was everything. But when I went through that program of the whole, I didn't know about the 12 modules, but when I went through the holistic picture, which Dr. Sandy and, that discovery call, provided me, that was a matter of seconds, that I said, that's what I was aiming for. And that's what I need to do for my future.
Yeah, that's so awesome.
Simple word, right? And then rest is the history. I started in September 2022, graduated in August 2023.
And here you are.
And here I am with another, brilliant colleague, friend, Krisler. And so that's all about it.
Yeah. Wow. Oh my goodness. Thank you so much for sharing all of that. So many beautiful stories interweaved into one whole life. And I'm super excited to see what's next for you. I think that you have so much potential based on your experience, your knowledge, all of that. So I'm really excited to see what's ahead for you. For those that maybe are wanting to know more, or maybe they have questions for you, where can they find you? Where can they connect with you?
Beautiful. Thank you. So I'm pretty much available, mostly like very frequently I'm on LinkedIn.
Mm-hmm.
And on LinkedIn, my name is Dr. Mahboub Siddiqui.
Mm-hmm.
So this is, and maybe you can share later on when
Yes,
invite
I'll
them.
put
Yeah.
all of this
So
in the
yeah.
description.
So
Yeah.
that's the most. Otherwise, I'm reachable through email as well, which is my name at gmail.com. So it's Mahboub Siddiqui at gmail.com. I'm
Mm-hmm.
pretty much active on Facebook. I started using now Instagram because I thought I'm too old for using Instagram. But then recently I realized no, it's one of the, so nothing is bad.
Right.
Yeah. So these are the platforms. I'm on Twitter as well, but again, I haven't started using it professionally. But
Mm-hmm.
I found it so effective in my previous role when I was working as the global product manager,
Mm-hmm.
in connecting and in all sort of networking. So as I said, I'm pretty much across the social media, and email I've already shared with you,
Yeah.
and
Well,
LinkedIn.
I will put all of that information in the description of the show so that people can connect with you. Again, thank you, Mahboub, for being with me today. I really enjoyed hearing all the details of your story, and I know that someone out there is going to benefit from hearing it. So I appreciate your time.
Thank you so much, Krisler. And just one last thing, I
Mhm.
really appreciate this opportunity, and I hope the whole thing which I have described, it was not boring for you or for the listeners.
Yeah, it was great
Yeah.
to me.
Thank you.
Um,
Thank you.
so
I
for those,
appreciate it. Yeah.
for those of you that are watching or listening to the episode, make sure you subscribe so you don't miss any of the episodes, and leave us a comment. Let us know what you thought. And until next time, I'll see ya. Bye.
Bye.